Hello everyone, and thank you for joining me today. My name is Dr. Chioma Kas-Osoka, and I am an assistant professor in the Department of Public Health at Meharry Medical College. I'm excited to present on our project titled A Community-Based Approach to Examining Sexual Health Access for Youth, a research initiative as part of a Career Development Award in collaboration with Meharry Medical College and the Vanderbilt Institute for Clinical and Translational Research. Let's start with some background. Youth involved in the legal system face a disproportionate burden of adverse sexual health outcomes. They experience higher rates of sexually transmitted infections, unintended pregnancies, and unmet reproductive health needs, all compared to their non-justice involved peers. Yet access to consistent, developmentally appropriate sexual health resources remain limited and unreliable. These challenges are shaped by organizational policies, stigma, and cultural barriers, including conservative or faith-based influences that can restrict outreach and education. Our study takes a community-based participatory research approach, centering the voices of service providers who work directly with youth navigating the legal system daily. Our main goal is simple but powerful: to use a community-based approach to examine sexual health services and resources available to youth involved in the legal system. By doing so, we aim to highlight both barriers and opportunities for improving equitable access to care. Before launching the study, we convened a community engagement studio to refine our interview guide and gather early feedback from service providers. We began recruitment in late 2025 and developed flyers to reach participants, including community-based organizations, nonprofits, clinics, and legal offices. All interviews were conducted and transcribed via Zoom. Participants also consented and completed basic demographic data using REDCap. This participatory and flexible design allowed us to center the experiences of those working most closely with youth involved in the legal system. To support engagement, we distributed recruitment flyers digitally, a crucial step in reaching diverse service providers while minimizing barriers to participation. Let's move to our findings, which revealed several key themes. First, many providers reported limited organizational involvement in sexual health services. They expressed frustration at not having the infrastructure or partnerships needed to serve these youth effectively. Second, the data showed that youth in the legal system often have complex and high unmet sexual health needs, compounded by inconsistent access to health care and interrupted service continuity. Third, faith-based and structural barriers still impact accessibility. Some providers felt the conservative beliefs and policy restrictions limited the services they could offer. And finally, structural and logistical barriers such as funding gaps, staff shortages, and transportation issues consistently blocked program implementation. Several provider quotes captured these challenges vividly, from limited awareness of available resources to the need for proactive rather than reactive approaches. Some emphasize that partnerships and trust are essential, especially when working with vulnerable populations. Others noted that youth engagement and compliance often suffered without consistent support and coordinated care. So what does this all mean? Our findings highlight substantial gaps in sexual health education and access for youth involved in the legal system. Service providers frequently lack the training, funding, and institutional support needed to address these issues effectively. However, there's also reason for optimism. Providers showed a strong willingness to collaborate and share best practices. This underscores the need for coordinated, culturally responsive, youth-centered health strategies that reflect the realities faced by this population. We'd like to acknowledge support from the National Institute of Health's KL2 funding, the Vanderbilt Faculty Research Scholars Program, and our dedicated community partners who have participated in interviews. Thank you for taking the time to learn about our work. We hope this research inspires continued dialogue and action to make sexual health services more accessible and responsive for youth within the legal system. For more information or collaboration opportunities, please connect with our research team at Meharry Medical College. Thank you.